Steve, thank you for those kind remarks, I think. But I want to say thank you for this invitation to join with this wonderful conference. Having been involved with a number of conferences myself, I would like to congratulate Steve and his team for all the work, the effort, the phone calls, the timing, and gathering. You can just imagine how appreciated that can be. All right. Now, I've got an hour and a half. Steve, that puts it to 4 o'clock, I guess, to try to see if we can't together end and cure coronary artery disease, cardiovascular disease. Those lights are pretty bright, so I don't think I can see that screen over there, but I've got a little extra one here. All right. Now, little boilerplate here. The key is this. One of the things to me that is so embarrassing for our medical profession is, as you see on this next slide, how long have we in the United States have known that half the planet Earth doesn't seem to have the leading killer of women and men in Western civilization, cardiovascular disease, all right? And we've had American Heart Association, American College of Cardiology, our professional organizations, and they've published, what, tens of thousands of papers over the last 80 years. And 80 years ago, what was emerging as the #1 killer of women and men in Western civilization? Cardiovascular disease. Now, 80 years later, 10,000 papers later, a lot of different drugs later, a lot of different procedures, stents, bypasses. What is now still the #1 killer? We can do a lot better. I got here in time to hear Colin Campbell, and Colin and I have been close friends really for over 30 years. And it was interesting how common this pathway seems to be of pushing nutrition off to the side. It doesn't seem to be glamorous. It's not like doing a bypass operation or something like a mechanical, like a stent. But what we've really got to begin to pay attention to, not just for cardiovascular disease, but really for the host of a special autoimmune disease, chronic disease, we've got to start treating the cause. Now, I always like this. This is the oldest slide in my presentation. And it was taken in June of 1968 when I was leaving Vietnam. I had spent a year there as a combat surgeon. And the reason the reason I show this slide is I think it's so important to let you know that our data from Korea, when we autopsy battle casualties in Korea, at an average age of 20 years, 80% of those GIs already had gross evidence of coronary artery disease you could see without a microscope, but not enough. Not enough yet for their cardiac events, but the foothold of this disease is established. So that same study is then repeated, this time 45 years later. Now we're looking at young women, young men who have died of accidents, homicides, and suicides. And now the disease is ubiquitous. Everybody. You go through high school in this country, and you get a diploma. And you also get the foundation for coronary artery heart disease. Not a good plan. Now, I can't see with those lights, but I'm just going to guess that how many of you in this audience are over the age of 17? You see, I mention that because I find I always get really worked up and excited when I'm speaking with patients. All right. Here was when we had a chance to absolutely get it right. World War II. The Axis powers of Germany overran the Low Countries of Holland and Belgium. They occupied Denmark and Norway. And characteristically, they took away their livestock for their troops. Their cattle, their sheep, their goats, their pigs, their chickens, their turkeys, gone. Suddenly, these Western European nations were now plant-based. And in 1951, reporting in England's leading medical journal, The Lancet, Drs. Strom and Jansen looked at the data from this time period, and lo and behold, I think you can see if we work together, starting here on the left, you can see in 1927, heart attack deaths, stroke deaths in Norway going up. 1930 going up, 35 going up, 1939. In come the Germans. Whoop! 1940. Whoop! 41. Who knew these Germans were these great public health educators? But look what happens in 1945. The death of Adolf Hitler, the cessation of hostilities in the European theater. Immediately back comes the dairy, back comes the meat, back come the strokes, and back come the heart attacks. But sadly, we just did not get it right. Now, those of you who are looking on the right are going to say, this is a pretty diseased artery. And you're probably thinking that when that closes, there'll be a heart attack. Well, interestingly enough, probably not. Why? Because that is an old, old plaque. It has taken years for this to fill up with cholesterol and calcium and muscle and inflammation. And as that has occurred, the downstream heart muscle has been significantly deprived of oxygen and nutrients. And so the body will often build in its own bypass. We call those collaterals, which will develop around the outside of the artery. Here you can't see them. But those collaterals supply enough blood to the downstream heart muscle so that even when this closes off, those collaterals will sustain the downstream heart muscle viability. And what I want you to notice on the other side, even those of you in the back can see that tiny little dark line, the innermost lining of the artery, the endothelium. There are two words that I want you to carry home today from this presentation, and that's the first one, endothelium. All experts in this disease would agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be that delicate innermost lining. But what happens is when you eat this cheeseburger, milkshake, and pizza, things get sticky, sticky, sticky. Your platelets get sticky, your LDL cholesterol gets sticky, your white cells get sticky, and even your endothelial cells get sticky. So, now this is the one you've been waiting for. This actually is from Peter Libby from Harvard, and that's okay, even though I went to Yale. Let's get it right. To orient you, in this blue area up here, sorry, so, see if I can make this work right. In this blue area up here is where the blood is flowing. And then you see these tiny little endothelial cells which separate the flowing blood from the artery wall. Together, here on the left, what you're looking at is your LDL cholesterol, which is orange. It finds a crack, a fissure, an opening, and it migrates into the subendothelial space where it is no longer orange because Peter Libby from Harvard wants you to know that it's been oxidized by these nasty free radicals. And now what we have is a small, hard, dense, oxidized LDL particle, which the subendothelial space does not like, and calls upon the SWAT team. Our white blood cells, which here Peter Libby from Harvard has painted blue in honor of Yale, and we like that. And here you see this SWAT team, macrophage, going across, gobbling up like Pac-Man, all these small, hard, dense LDL particles until we get all the way over to here. When we now do in medicine, that we do so often, we change the name and is now called a foam cell. And the foam cell is truly the Darth Vader of this sequence of events. Why? Because the foam cell elaborates these nasty, nasty chemical substances that we call metalloproteinases. And metalloproteinases, stromelicin, elastase, collagenase, myeloperoxidase, those enzymes progressively they erode the cap over the plaque. And you can see right here, here's a plaque blocking the artery by 35%. And right here in the upper part of it, you see it's torn because it's gotten so thin that the sheer force of blood racing over it tears it. Now that critical moment has occurred. You have ruptured your plaque. So in a matter of further minutes, we go over here to B, and now what do you see? You see this clot forming. And that clot is in and of itself self-propagating. So in a matter of further minutes, here we are, all the way over. In C, what you're looking at, this clot is now completely blocked off the artery. All the downstream heart muscle here has been deprived of oxygen and nutrients. It's lost its viability, it's dying, and that's 90% of heart attacks. But the exciting thing is this. If I do my job correctly today, every one of you and your friends and relatives can make themselves heart attack proof. How are you going to do that? You're going to make yourself heart attack proof, not with inventing another pill, not with inventing another procedure like a stent, not with another operation like a bypass. You're going to make yourself heart attack proof and stop this cascade of events where things will not get sticky. You'll not have migration of your LDL cholesterol into the subendothelial space. You'll have no SWAT team. You'll have no foam cell. You will not thin out the cap over the plaque. You will strengthen the cap over your plaque. If you strengthen the cap over your plaque, it cannot rupture. If you cannot rupture your plaque, you have made yourself heart attack proof. With your new biochemistry, which has been changed by whole food, plant-based nutrition. All right, now, forget the x-ray. What you're looking at here. The artist has given us an artery that is half open and half filled with plaque. In the half opened area, you can clearly see the endothelial cells lining that half open artery. Now, up until 1980, We used to think of the endothelial cells as these cute little red bricks that were lining our pipe. Well, that all changed. In 1980, down the road in Brooklyn, Dr. Furchtgott was taking the largest blood vessel in the rodent, the aorta, and he would take it and then do this sort of elliptical spiral staircase cut through the aorta, through the endothelial cells. Then he would immerse it in a bath of saline, and it would constrict. But one day, he took that aorta, no cut, no injury to the endothelial cell, immersed it. Whoop! It dilated. It dilated. He did it again. It dilated. So suddenly now, the race was on globally. What was the EDRF that Dr. Furchtgott had discovered? Endothelial-derived relaxation factor. Kind of rolls off your tongue. Yeah. And thank heavens that term was with us only 8 years. In 1988, 3 men, Dr. Furchtgott, Dr. Murad, Dr. Mcnamara, discovered that the EDRF was a gas. This is the second word you're going to have to remember today. The gas was called nitric oxide. Nitric oxide. Those 3 men, for that discovery, received in 1998 the Nobel Prize. Why would you get a Nobel Prize for discovering a gas? Well, that gas is responsible for absolutely the salvation and the protection of all of our blood vessels because of its remarkable functions, which include, 1, nitric oxide will keep all the cellular elements within our bloodstream flowing like Teflon rather than Velcro, keeps things from getting sticky. Number 2, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your legs, the arteries to your heart, they widen, they dilate. Nitric oxide. Number 3, nitric oxide will protect the wall of your artery from becoming thickened, stiff, or inflamed, protect you from getting high blood pressure, hypertension. Number 4. Now, number 4 is the absolute key. A normal, healthy amount of nitric oxide will protect us all from ever developing any blockages or plaque. So literally, everybody on the planet Earth, whether you're from London, Berlin, Chicago, New York, or Manhasset, if you've got cardiovascular disease, it is because in the previous decades, you have now sufficiently trashed, injured, compromised, and turned your endothelial system into a train wreck that you no longer have enough nitric oxide to protect yourself from developing blockages and plaque. But the good news is this. This is not a malignancy. This is a completely benign foodborne illness. And once you can get your patients, your participants, to understand that never again are they to pass a single morsel through their lips that is going to further injure their endothelial system, then the endothelial system will begin to recover. Make enough nitric oxide so you can stop disease progression. And often, we will see significant elements of disease reversal. Now, example I sometimes use. Here is the level of nitric oxide that you had when you were 8 years old, all right? Now you're 24. Sadly, you get hit by a bus. You die. At autopsy, yeah, you've got early cardiovascular disease. 2 weeks ago, I got a phone call from a 48-year-old gentleman. Dr. Esselstyn, you'd be proud of me. I bought your book after I had a heart attack 2 weeks ago. But you'd be proud of me. I'm following your program 80%. My reply, thank you for your phone call. What you have told us is that in those previous 48 years, you had simply so sufficiently trashed and injured your endothelial cells, you no longer had enough nitric oxide to protect you from having this heart attack. And in addition, what you have told me is that 20% of the time, you were continuing to trash your few remaining endothelial cells to set you up for the second heart attack. Oh, Dr. Esselstyn, I didn't think of it that way. So I just noticed when I was doing this before, I could see you. And what I suddenly see in all these intelligent faces, they're saying to you, I wonder what my level of nitric oxide is. Well, we're going to go into that. First of all, on a research setting, how they check it, you take an ultrasound probe, place it over the brachial artery at your elbow, and then there's a readout on the screen. This is the diameter of your artery. Then you encircle your upper arm with a blood pressure cuff, which you will inflate above systolic blood pressure so that for 5 minutes, you have absolutely zero blood flow to your arm and hand. To your arm and hand. Yes, I've had that done, and no, it's not exactly habit forming. Then you release the cuff and immediately measure again with the ultrasound probe the new diameter of the brachial artery. In the normal individual, it'll be now 30% greater. 30% greater. Pretty exciting stuff. Now, the next thing that occurred with the endothelial cell was when Robert Vogel, chairman of cardiology at University of Maryland, took a healthy group of subjects to a certain fast food restaurant, which is characterized by arches, which are golden. And half of the group got the cornflakes, and the other group had hash browns and sausage. The group that had the group that had the cornflakes, brachial artery tourniquet test, normal. The group that had the hash browns and sausage, within 120 minutes after that meal, they couldn't dilate the artery. That single meal had so trashed, so injured, so compromised the ability of their endothelial cells to make nitric oxide, they didn't have enough to dilate their artery. However, being young, as they followed them into the late afternoon, early evening, they began to recover. But you and I know that the next morning for breakfast, it'll probably be scrambled eggs and bacon. Lunchtime, we'll have white bread with mayonnaise and cold cuts. And at supper time, baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on a salad, ice cream for dessert. Here in the good old USA, starting as kids, in our childhood, all day long, we absolutely hammer, injure, and destroy the ability of our endothelial cells to make nitric oxide. So when we have this epidemic of disease, cardiovascular disease in our 50s, 60s, and 70s, we've been working on that since we were kids. Now, what I'm going to show you next is what a good speaker is supposed to do, is tell you beforehand what they're going to tell you, then they tell you, then they show you another slide that tells you what he told you. So these are the functions of nitric oxide that we've just gone over. And we don't have time today to go over all of these wonderful natural protective mechanisms that we have, but we are spending time on one of them, the endothelial cell, which I know you're going to understand. Now, but to put your mind at ease about the others that I'm not going to spend time on, all of these, absolutely every single one of these defense mechanisms is absolutely optimized when you're eating whole food plant-based nutrition. So now let's get into where the rubber hits the road. You got to do a study. You can't just go out on the circuit with hype and snake oil. You got to do the research. The science is where you're going to get your credibility. That's absolutely key. Now, this was in 1985, and I still had all my surgical obligations, so this was a small study. But all of these persons did have severe triple vessel cardiovascular disease. They had failed their first or second bypass, they had failed their first or second angioplasty, or they were too sick for these procedures, or they had refused, and 5 were told by their expert cardiologist they would not live out the year. Now, my concern was that as a general surgeon, seeing these significantly ill patients with cardiovascular disease, my concern was how was I going to get them to be compliant? How will they adhere? Because to make this work, it had to be 100%, and this is a highly significant lifestyle change. So the mantra that I decided to use for these first group of patients was the same mantra that I had been using for my cancer patients that I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So the first 5 years of the study, I saw every one of these patients every 2 weeks in the office. We drew their cholesterol, we checked their blood pressure, their weight, and I went over every morsel they ate. At the end of 5 years, I got more courageous, and I started seeing them once a month. And then at the end of a decade, they were now pretty well on autopilot. So I stretched it out to quarterly. And then at 12 years, we wrote this up in the scientific literature, which makes it one of the longest, if not the longest, study of its type, 12 years, which is almost half a career. But it was exciting, and I'm going to share, first of all, with you the foods that we know now injure the endothelium, and these were the foods I didn't want these patients to have. Not a drop of any kind of oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing, no oil. And nothing with the mother or face, meat, fish, chicken, fowl, turkey, and eggs, and no dairy, milk, cream, butter, cheese, ice cream, and yogurt. And I don't like sugar or caffeinated coffee. And for the patients that have heart disease, I've asked them to withhold nuts and avocado. Now, in my book, yes, patients who do not have heart disease do have nuts. They do have avocado. And there's a number who have taken issue with me on my stance on nuts. And I'll just spend a moment there. First of all, let me just say how much I respect everybody in this movement, how I respect their science and their results. And I hope they do the same, because with the program that we have presently, we got a winner. When patients do it, we stop their disease, and we often get reversal. So I'm a little bit old-fashioned. I'm The reason I don't like nuts, I think it's probably fine if you have 3 walnut halves on your cereal. I don't think that would hurt anything. But that's not what people would hear. They say Esselstyn was down at Melville, and he said nuts were okay. So, yeah, this is about one of the more addicting foods you can find. If they hear that, the nuts were going to be in the glove compartment. They'll be in the bathroom, the kitchen, the bedroom, the hallway, the workbench. And then what have we got? This avalanche of saturated fat. And I have yet to see a single study in the scientific literature where they have taken patients seriously ill with heart disease and let them have peanut butter and nuts, all they want, and cashew sauce, and ever see the results of arrest and reversal of disease. So we're still waiting for that. I would be probably quite open-minded if I could see that study, but I think the amount of saturated fat would, in that situation, would probably work against us. And as I say, right now, we got a winner. It's hard for me to leave that. So, now, what are you going to eat? Well, we'll come to that too. But first, I know some of you have been nervous when I say no oil. Here is a peer-reviewed scientific study. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. If you'd like more on this, earlier last year, in the inaugural issue of the International Journal of Disease Prevention and Reversal, I wrote an article entitled, "Is Oil Healthy?" And I go through the animal studies and the human studies showing how oil injures endothelial cells. Okay. Now, this is some very interesting work that'll give you a good argument if you get into somebody who's trying to push keto or paleo or Atkins on you. This is lecithin and carnitine. Those molecules are found in the animal products that you see listed underneath. And Stan Hazen, who did this research at our institution, was looking particularly at omnivores, because when you feed an omnivore these animal products, they contain bacteria in their microbiome, in their gut, that when they metabolize on lecithin and carnitine, they produce a molecule called MAO. MAO. And what happens is, rapidly, MAO is oxidized by your liver. So now we have TMAO, trimethylamine oxide. And here's the schematic of this, if you'd like to see it. You start with lecithin and carnitine in the animal products. The omnivore has gut bacteria which can metabolize lecithin and carnitine to trimethylamine oxide, which then leads to vascular disease. But the exciting thing, to me, that what Stan found, when he took a person who was totally plant-based, and gave them a lamb chop and measured their blood, no TMAO. Why? Because persons who are totally plant-based do not contain the bacteria in their gut to convert lecithin and carnitine to TMAO to injure your blood vessel. Now, and sadly, if you keep eating that lamb chop as a plant-based person 4 or 5 days, now you begin to convert your microbiome to that more lethal colony of bacteria. Now, this is the one slide in this presentation that has nothing to do with cardiovascular disease. But I always like to have it there because it gives you a momentary break. But it was such an absolutely, to me, memorable and unbelievably powerful moment in nutrition history. In 2015, in October, at the meeting of the WHO, the World Health Organization, just think of it. Persons delegates from all over the country came to the WHO and agreed that red meat had the same level of carcinogenicity to make cancer as did smoking cigarettes. Pretty powerful moment. All right. Now, here's what you're going to eat. You're going to eat all these marvelous whole foods for your pasta, bread, rolls, and bagels, 101 different types, legumes and lentils and beans, all these marvelous red, yellow, and green leafy vegetables, and some fruit. Now, I'm going to spend a minute on this because it's so important. By now you understand that we're doing everything we can to restore nitric oxide, all right? Now the body really has two ways of making nitric oxide. The primary way for all of us as we grow from childhood upwards is the lining of our blood vessels. The endothelial cell makes that nitric oxide. However, by the time you're 50, you've lost 50% of the nitric oxide producing capacity of your endothelial cells, even though you're in good health. And now we have the problem that as we get older, that really begins to give out. By the time you're over 80, you've lost over 70% of your endothelial capacity to deliver nitric oxide, and nitric oxide is so important for your health in many ways. So now we have discovered that there is a second way that the body will make nitric oxide. But first, I want to just lead you into how this emphasis on green leafy vegetables that we got started about 8 years ago, I want to just give you a little bit background of this. First, I asked the patient with heart disease, when we first see them, if they could imagine shrinking their head to a size that they could crawl inside the coronary artery. They would see that the blockage is an absolute cauldron of oxidative inflammation. So we need antioxidants, but no, do not go down to the health food store and buy a jug of pills that says antioxidant because it doesn't work, and it's going to be harmful. You are going to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value, oxygen radical absorptive capacity. So this means that if you're having raspberries, blueberries, strawberries, blackberries on your morning oat cereal, that is a terrific start. However, nothing is going to trump the antioxidant value of green leafy vegetables. So I need you to chew green leafy vegetables roughly the size of 3/4 of your fist 6 times a day. 6 times a day after it has first been boiled in water, 5.5 to 6 minutes so it's nice and tender. Then you must anoint it either with some balsamic vinegar, a few drops, or rice vinegar. Why? Because the acetic acid in the vinegar has been shown to restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal. Again, alongside mid-morning snack. Again, with your lunch and sandwich. That's 3. Mid-afternoon, 4. Dinner time, 5. God, I adore it when you have that evening snack of kale. Number 6, what are you doing? All day long you are basking and bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidant. Now, the second thing that chewing the greens does, it restores once again the capacity of your bone marrow to make more endothelial progenitor cells. What are they? They replace our senescent, injured, worn-out endothelial cells. Now, the third thing that chewing the greens does, and this is key, because this is the second pathway to make nitric oxide. As you chew the green, it is a nitrate that you are chewing. As you chew that green vegetable nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria in your mouth will reduce that green nitrate to a nitrite. Now, when you swallow the nitrite, your own gastric acid will further reduce the nitrite to more nitric oxide. Now, again, you heard Colin Campbell talk about chewing, and I totally agree. Because when if you just slug down a blenderized smoothie or juicing of this vegetable, I need it in your mouth to mix with those facultative anaerobic bacteria, which are going to reduce it to a nitrite. Now, the caveat, so important to remember here, you can't use mouthwash. If you use mouthwash, you destroy the ability of those bacteria to do their job in your mouth. Antibiotics would do the same. As far as the stomach is concerned, we don't want you to be taking antacids if you don't need it, because antacids will decrease the level of acidity in your stomach so that you cannot reduce the nitrite to more nitric oxide. Lots to think about, but absolutely so powerful, because as your endothelial cells are really wearing out as you get to be in your 80s, you can really kick in this second pathway, and there's really no end. And this is, I'm so greedy for success with my patients that I'd ask them to do this 6 times a day. So what are they doing? Literally, all day long, they are absolutely restoring the very molecule, nitric oxide, the deficiency of which led to their having this heart disease in the first place. All right. Everybody got that squared away? Good. I heard apple cider vinegar. I just know the research with rice vinegar and balsamic, it may or may not work with apple cider vinegar, but I don't have the research on that, so I don't push it. No. Okay. No oil! Now let's do this. Here's where the rubber hits the road. This is science. I'm going to show you some angiograms of disease reversal, and these were all reviewed in triplicate in the Cleveland Clinic core laboratory by senior technicians who do this all day long for national medical trials. So when I give you a certain % of reversal, I know it's right. This first one you're looking at is the widowmaker, the left anterior descending coronary artery, and a 67-year-old retired pediatrician. And if you compare the diameter at the left with the diameter on the right is 10% larger. This is a lot easier to see in this circumflex artery that goes to the back of the heart, where you're in this 58-year-old factory worker. And this was described, this was described as a 20% improvement from here to here. And in this retired 54-year-old security guard, the right coronary artery, this was described as a 30% improvement from here to here. Now this, on the other hand, is a surgical colleague, a friend of mine, Joe Crow. Joe replaced me as chairman of the breast cancer task force. In 1996, Joe, with a cholesterol of 156, began to get chest pain. No family history, exercised regularly. He did not have high blood pressure. He was not diabetic. He was not a smoker. Chest pain. Cardiology in October of 1996 worked him up. And what did they find? Nothing. So a month later, the third week in November, he finished his surgical schedule, sat down to write post-operative orders. And suddenly, the elephant was on his chest, pain in his jaw, shoulder, arm. He was having a heart attack. He was whipped down to the cath lab. They start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate. He stabilizes, and 3 days later, he's discharged from the hospital, but he's very depressed. Why is he depressed? Because at the time of his angiogram, what they found was that of the widowmaker, the lower 1/3 was all moth-eaten and diseased over too long a segment. You can't just pound in stent after stent. And it was too far down the artery to qualify for bypass surgery. So he was discouraged that he didn't think they could do anything for him. So 2 weeks after his heart attack, Ann and I had Joe and his wife out for supper. Joe, come on. You've been eating this absolutely hideous Western American diet. You've got the typical disease. We've got 10 years of data. Why don't you think about going plant-based? Okay, yes. They couldn't do anything else for me. I'll give it a shot. But I'm not taking any of those statin drugs. I don't trust them. Too many side effects. Fine. Your call. No problem. He became the absolute personification of commitment to whole food, plant-based nutrition. And over the next 2.5 years, total cholesterol plummeted. His LDL went from 98 to 38. And then in 2.5 years, he had another angiogram. Now, in the surgical office areas, our doors are 3 doors apart. So at noontime, on the day that I knew earlier that morning Joe had had his follow-up angiogram, I walked over, let myself in his office. There he was, sitting behind the chair. Joe, understand you had the old follow-up angiogram earlier this morning. Mind sharing with me? How did it go? He got up from his chair, walked around his desk, put his arms around me, some of these, said, I think we're doing okay. And so I said, would there be any chance that I could see okay? And he said, yeah. Now, one thing here that's important. Yeah, this was very, very exciting for us. And this isn't going to happen to everybody. But when you have a young patient where the plaque is young and the plaque is made up of fat, cholesterol, and inflammation, you can get these kind of dramatic reversals. However, this may be obtained to maybe somewhere between 25 and 35% of patients. What about those other 75% or 70%, where they're in their 50s, late 50s and 60s and older. They've had the plaque for decades. It's made up of fibrosis and scar and calcification. It's not going to go away. And yet, it's going to be my job today to show you exactly how it is that those persons just as well can get back to full activity of daily living without restriction. So that will be important. Now, despite my sparkling personality, of those original 24, there were 6 nice guys. But boy, I knew in the first month, they just didn't get it. I had no money for this study. So I returned them after the first month full-time to their expert cardiologists. And they became what I call a sort of a quasi-control group. And over the next 13 years, or 12 years, in the hands of expert cardiologists, those 6, 2 died, and the other 4 had to have bypass surgery. On the other hand, what about those 18 that stayed with our study for those 12 years? I wanted to know how many cardiac events of worsening disease they had experienced in the 8 years prior to coming into our study while they were in the hands of expert cardiologists. And here you see 49 events of worsening disease categorized that you see here on this slide. However, once they came into our study, over the next 12 years, 17 of those 18 had no further events. Yeah, we did have one little sheep at 6 years who wandered from the flock, got into the French fries, lamb chops, glazed donuts, more angina, had a bypass, but now he's back with the flock, but proves the point that I'm trying to share with you today. All right. Now, I was terribly, terribly excited about the results that we were getting. But new information, as Dean Ornish found as well, is not always received with open arms. We got absolutely hammered. Dr. Esselstyn, who do you think is going to follow that diet? That diet is too strict, severe, extreme. You know, now wait a minute. I love it when somebody asks that question. If you were to take our diet to Okinawa, the first thing they'd say, well, Jiminy Christmas, you guys have finally caught on. How long did it take you to do this? And there's not one single food that we ask people to eat that they haven't been eating throughout their lives. Yes, we are asking them to not eat the foods that are destroying their endothelial capacity to make nitric oxide. We want them to stop that completely, yes. Now, there are some who say, well, it wasn't randomized. It wasn't somehow, it was just, wasn't large enough, but here we did have the data. So what we decided to do was we repeat it. This time, close to 4 years, this time, not 18 patients, but 200 patients, 2 lost to follow-up, so 198. Of those 198, 177 followed the program, and 21 did not. So we had a compliance rate of 83%, almost 90%. Now, many physicians have seen, understood, and decided they would try to adapt our approach. And I'll hear from them and they'll say, Dr. Esselstyn, maybe 1 out of 50 of my patients will do this. How do you get 90%? And I think this is key. The way you get 90%, the most important thing you must do if you're going to get a patient to make a lifestyle change, you have to show the patient respect. The only way that I know how to show a patient respect is to give them my time. So at the present, I work at the Cleveland Clinic Wellness Institute. And once a month, usually for no more than 12, 14 patients, always from throughout Canada, throughout the United States, or from overseas, these patients come to Cleveland, and they're going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. And the other thing that I think helps, 2 weeks before we have our seminar, my secretary will send to me a list of the people who are coming and their phone number. And I'm old-fashioned enough that I insist on personally calling every one of those patients myself to get my arms around their story, at the same time, provide them an opportunity to ask questions of me, so that coming to this seminar, we have a strong platform from which we can all move forward. And then we always give them a very hefty notebook of everything that they have learned, a video of the entire seminar that I filmed from an earlier one. And then we always have several local or regional participants who've had a previous successful experience share their story with those who are in attendance, who can then say to themselves, listen, if he or she can do this, I can do this. And you're wondering how no, they were sick. 119 of the 177 had already had bypass surgery or a stent. The second line down, patients avoiding intervention. This, to me, really is exciting. When patients are in the middle of having a heart attack, no question, a stent or bypass may be life-saving. But when these procedures are offered electively, not an emergency, it's very clear if they're willing to make this transition, they don't have to have the intervention. This was actually very clearly shown 2.5 months ago at the American Heart Meeting in Philadelphia, a study called ischemia. And that word means that these were all persons who had deprivation of blood supply to their heart. And then there were 5,000 divided into 3 groups: optimal medical therapy with stents, optimal medical therapy, bypass, optimal medical therapy alone. At the end of 5 years, no difference. My criticism of the study: optimal medical therapy, I would have preferred to have whole food, plant-based nutrition. All right. So what about the results? We did have one failure, a gentleman who had a tendency to have high blood pressure when he was in China, just eating off the economy, all that salt, and had a small stroke from which he recovered. The other 21 patients who were not adherent, 62% had progressive events. And here what I've done is sort of compare our results. If you go up on this line, this is major cardiac events: heart attack, stroke, and death. Here is the Mediterranean diet from Lyon, France. At the end of 4 years, 25% heart attack, stroke, and death. Columbia Presbyterian Hospital, and this is the natural history of coronary artery disease, 20%. Bill Bowden's Courage study, 19%. So somewhere around here, 22, 23%. And here we are, 0.6%. That's over a 30-fold difference. What's going on here? Here's what's going on. Ever since the days of Hippocrates, there's been a basic covenant of trust that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today, in cardiovascular medicine, that's not being done. I think it's why 4 years ago, I was invited to become a member of the American College of Surgery. A little unusual for a general surgeon to be in that group. However, they asked me to become a member of their nutrition committee because we're trying what we can to get cardiologists to be aware of the causation of the illness that they have been designated to treat. Now, of all things, on that same month, July of 2014, I wrote another paper of 3 patients. Why? Because these 3 patients, to me, were the absolute personification of the failure of present-day cardiology, although in several of those patients it was from my own institution. Now, the first patient, Bob Mercer, is a gentleman from Newfoundland, Canada. I have yet to meet him face-to-face, but at age 44, he had a complete blockage of the right carotid artery to his brain, had a small stroke from which he recovered, and then he had such horrible angina, they found a courageous surgeon in Toronto who would operate on him, even though he had one totally blocked artery to his brain. But he had a great result from that surgery. Now he was 69 years of age, and he was in trouble. He'd gained 40 pounds, he was diabetic, he had all this angina back, he had erectile dysfunction, and his one remaining carotid artery was now 90% blocked. So, of all things to have happen, his 37-year-old daughter had a heart attack. And during her convalescence, she found a book, Prevent and Reverse Heart Disease. And she said, "Pop, we got to do this together." They did. A year later was my first awareness of Bob Mercer. He wrote, "Dr. Esselstyn, I wanted to thank you. I've lost 40 pounds. My diabetes has disappeared. All my angina has disappeared. My erectile dysfunction has disappeared. And my one remaining carotid artery, which was 90% blocked, is now 67% blocked." And here, I think we've got a picture of Bob Mercer. Art Soteros, in a suburb of Cleveland, at age 32, heavily, much overweight, developed diabetes. Age 42, chest pain, angina, and at the Cleveland Clinic, the first of 14 stents over 7 years. Then he was told, you got aggressive disease. You're going to have bypass surgery. So he did. And that was good for 12 months. More angina. So his wife, he was told by the doctors, "You got this aggressive disease. You'll just have to see what you can do on drugs." His wife found out about this. He came. He was marvelous. Lost 40 pounds, got rid of his diabetes, and got rid of all of his angina. And the next, Jim Mcnamara. On the left, you can see he was before he lost 40 pounds. He was pre-diabetic, and he had to have surgery on a partially blocked carotid artery on the right side. It was a total failure, and it just simply closed off the artery permanently. Then he began getting pain in his left calf. He was found to have a fair amount of disease in his arteries to his leg. And they said, "You'll have to have surgery." The first one failed. Second one failed. Third one failed. Told, "You've got this aggressive disease. You'll have to get along on drugs." Whenever he put his leg up at night to get in bed, within minutes it would start this numbness and tingling that would drive him crazy. His wife found out about this. He came. Within 4 months, all of his leg pain was disappeared. No longer had any pain putting his leg up at night. Lost 40 pounds, got rid of his pre-diabetic state, and here he is dancing with his daughter. So, summarizing, comparing to stents and bypass, comparing the diet, there's no mortality. You're eating Brussels sprouts and broccoli, you don't die. No morbidity from the diet, no added expense. The benefits improve with time. And to think of it this way, the poor patient who has had a heart attack is walking around with a sword of Damocles over their head, wondering, when do I get my next heart attack? Nonsense! You never have to have another heart attack. Absolutely. Now, what is the good of having a great heart if your brain isn't there? So we know that by age 85 in Sweden or this country, 50% of people have dementia. It's a hell of a reward for a lifetime of hard work. So it was Megan Leary and her team from the West Coast who gave us some great insight into this when, in 2001, reporting at the stroke meetings in Miami, she had looked at over 5,500 MRIs of the brains of Americans. And what they begin to see at age 50, these tiny little white spots. What are these little white spots? Little strokes. But you know, age 50, big brain. Tiny stroke. Not a problem. But now, you snap your fingers, you're 65. You've had 15 more years of the good old American diet. And now you sound yourself saying more often than before, sweetheart, where did I leave the car keys? You get that. Bingo, 10 more years, you're 65. You look at her, sweetheart, where did I leave the car? Bingo, you're 85. You look at her, are you my sweetheart? I can't reverse that. You don't suddenly wake up on your 85th birthday with dementia. You work hard in all those preceding decades to lay the foundation for that dementia. Here is a normal MRI. I counted 90. Can you imagine a message trying to go through all of that scar? Now, if you look on the left, what you notice is that right here, the brain is right up to the skull. Good, healthy, big brain. On the right, wait a minute, what's all this big gap here? Between the brain and the skull. That's atrophy. That's cerebral atrophy. You don't want cerebral atrophy. What do you do to prevent that? Exercise. Exercise. Whether you're going to walk 5 days a week, almost fast enough to break a sweat, or you can bike, or you can swim. But exercise will protect the hippocampus for your memory and the frontal lobe for executive thinking, two areas that can enlarge. Now here, what you're looking at on the upper left is the thigh muscle of a 40-year-old triathlete. On the upper right, the thigh muscle of a 75-year-old couch potato. Lower one, thigh muscle, 70-year-old triathlete. Exercise. Now here on the left, what you're looking at is a pulse volume. This was in a patient, one of our earliest group, crossing the Skyway. To my office, he had to stop 5 times to allow the blood to get back down through these narrow vessels in his thigh. But I was so focused on his heart, I totally forgot about his leg. 10 months later, in the office, he said, Dr. Esselstyn, you recall when I first started seeing you, I was stopping 5 times crossing the Skyway to your office. Yep. He said, you know, the last month it got to be 4 times, then 3, then 2, then 1. He said, you know, the pain is gone. I don't stop. Don, back you go to the vascular lab. Now what you see, bingo, on the right. What is this? It's double. It is double. So now there we were. Within 15 months of starting our study, we now had absolutely irrefutable, rock-solid scientific data that food and food alone could reverse cardiovascular disease. And you're going to say, well, wait a minute. What about the statin drugs? Well, wait a minute. This is 1986. We didn't have statin drugs. So I've given you 2 examples today. Dr. Crow, who refused statins. Don, we didn't have any then. Pretty impressive what you can do with whole food, plant-based nutrition. Now, that's another, and this happens to be a retired high school chemistry teacher, age 78. And in his retirement, he and his wife enjoyed entering the square dance competition. But it was always during the fast square dance that he was getting bilateral calf pain. So he saw these vascular surgeons, and he wasn't enamored of the big operation that was planned for him. You can see here the image of the disease in his vessels. And so he found us over the internet, and he came for counseling. He said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of my calf pain? So I looked at him with great wisdom in my face. I said, probably about 10 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, I know in Cleveland, Ohio, what it's like when you look at a mystery on television or a sporting event. I don't know what it's like where you folks are from, but in Cleveland, just before you hear the advertisement, you will hear the mellifluous tones of the announcer say something like, when the moment is right, will you be ready? Now we all know that the penile artery is quite tiny, and we know that the coronary artery is quite a bit larger than the penile artery, and therefore, not infrequently, before somebody comes down with heart disease, they'll find that they're no longer able to raise the flag. However, all is not lost. Not infrequently, 10 or 11 months after I've counseled somebody, I'll get a phone call. Dr. Esselstyn, yep. This is Mr. So-and-so. Yeah, sure enough. Yeah, I said, Dr. Esselstyn, I thought I ought to give you a call because recently something has come up. And I'm wondering if I don't owe you another check. Now, I promised you, before we wrap it up, that we would figure out how to deal with these patients who have a plaque in the epicardial coronary artery that is made up of scar, fibrosis, and calcification. It's not going away. Well, first of all, here's the data. What you're seeing over here is a PET rubidium dipyridamole scan. And you can see if it is orange or if it is yellow, that's good. But right here, where it's all green, that's poor. This was in a 60-year-old stockbroker from downtown Cleveland. At the time that he had that scan, on the left, I counseled him. 10 days later, his cholesterol was down to 137. 3 weeks later, he got it back. We repeated the PET scan. Now it's all suddenly back in 3 weeks. Nobody ever gets rid of a plaque in 3 weeks. So let's think this through a little bit. You're now looking at a heart without any muscle. But you do see clearly the three major arteries that you can see here, the right coronary artery, the left anterior descending, and the circumflex. They are riding on the surface of the heart. They get all the publicity. They get the stents. They get the bypass. Where do they all go? They all dive intramuscularly. They dive into the heart muscle where they deliver oxygen and nutrients. And look, just look at the thousands and thousands of cascading, interlacing intramuscular arteries there are. So I went down and spoke with Rodriguez, who is the chairman of the cardiovascular pathology section, who dissects 200 hearts a year from the deceased. And I said, Rod, how often do you ever see, once the artery has dived into the heart muscle, how often do you ever see in those vessels, in the muscle, any good old standard garden variety coronary artery disease? His answer, never, never. once in a very, very great while in a severe diabetic. Other than that, never. Now we had our answer. Because think of it this way. When we see these patients, originally, we see these heart patients come to us. Their endothelial cells, obviously, are just so beaten down, they don't have enough nitric oxide. So they're hardly making any vasodilator. And of all things to have happen, when you're that mean to your endothelial tissue, it is now making two molecules, endothelin and thromboxane. Endothelin and thromboxane that are your enemy. They are vasoconstrictive. They're tending to constrict the artery. So when we see those patients, this entire cascade of intramuscular vessels are now pinched, narrowed in spasm from thromboxane and endothelin. So what happened was, if you saw just moments ago, when you really get these patients to aggressively do it right, and in addition to eating this way, they're chewing the green leafy vegetables 6 times a day, making as much nitric oxide as they can, immediately, it appears, your endothelial tissues stops making endothelin and thromboxane and starts making more of the greatest dilator in the body, nitric oxide, that you can really begin to turn it around. And I can tell you where you see this clinically, so graphically, is if you've got a patient who has stable angina, because they can measure that themselves. Usually they go in a block and a half, 2 blocks, and they slow up because they get chest pain. They start this, suddenly it's 3.5 to 4 blocks before they get chest pain. The next week or two, it's now 10 blocks. What have you got? You've got them hooked, absolutely hooked. And also they're hooked once they understand how they created the disease by destroying their nitric oxide. Can you imagine a single patient in our seminar coming up to me afterwards and saying, Dr. Esselstyn, God, that was kind of interesting about the endothelial cell and nitric oxide, but you don't seem to understand. 2 weeks from now, Lois and I are having our 35th wedding anniversary, and boy, am I going to destroy some more endothelial cells. What? No. So, remember that endothelin and thromboxane, the vasoconstrictors, you get rid of those, all right. Now, here's a summary of the 8 ways you can measure reversing heart disease. I've shown you the reversal of an angiogram, happens with the stress test. I've just shown you the PET scan reversal, talked about the ultrasound, showed you the slides of the pulse volume, and of course the symptoms disappear of angina, claudication, and erectile dysfunction. Now I always like to wrap up my presentations with the picture of the building where for many years I was on the 8th floor as a surgeon, but I show it to you in Long Island because I want you to know what the trees look like in February in Cleveland. However, now that I've retired from surgery, I've worked for a number of years at the Wellness Institute. The budget is more modest, but the morale is high. One thing I've learned in 58 years from medical school, yep, brains, no question. Brains are important. But nothing seems to be as important as persistence, best exemplified by this young damsel, Life magazine, 1939, trying to learn how to do the splits. It's tough. But sure enough, the other day, in downtown Melville, was it, that Steve spotted her, and she had got it right. In conclusion, let me just say, the reason that I'm so passionate still about the field of medicine, even though it's been about 20 years since I've retired from surgery, is that we are truly on the cusp of what could absolutely be a seismic revolution in health. And this seismic revolution in health is never going to come about from another pill, another procedure, or another operation. The seismic revolution in health will come about when we have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as a locus of control to absolutely annihilate chronic illness. Thank you.